Hello everyone, this is Rotarian Sanjay Dugar, your host for the Rotary Sunday series, where we bring in experienced leaders sharing their thoughts, their ideas, the way they have done things in the past so that you can excel in all that you do or lead. This time I have a very, very special guest, our very own Rotarian Dr. Upendra. He is well known for the extensive work that he has done in the polio space. And without much ado, let me first of all welcome you, Dr. Upendra.
Thank you.
Very nice to have you here, and I'm sure that our viewers will really, really like to hear and see all that you have to share with us, especially around the key subject of yours, which is polio. So, polio NID is scheduled, and we are going to be busy in that. What is the present global polio situation?
Let me tell you, in 1985, we had 350,000 polio cases. That means it's almost 1,000 cases per day. What we have achieved so far is, to a great extent, we have controlled polio, but our dream is to eradicate polio. Over a period, polio has come down. Right now, there are only two countries, Pakistan and Afghanistan, which are endemic. Last year, each country had 6 cases of wild polio. But as on now, from January to February now, we do not have polio there also. This is the present situation. We are about to eradicate polio. That's what I want to tell you.
Fantastic. And yes, we need to eradicate polio. So why NID is important in this polio eradication program?
See, as per WHO, for polio eradication, we have 4 different tools, I can say. One is the routine immunization that is given to all the children immediately after birth. Second thing is we look for the acute flaccid paralysis cases, because that's one of the symptoms of polio, reporting and analyzing it. Third one is mop-up. Wherever we suspect that there is a polio case, we go for mop-up immunization. The last one is National Immunization Day, or NID, wherein we try to vaccinate or immunize all children aged less than 5 with oral polio vaccine. The principle here is, the moment you vaccinate, immunize all children at a time, polio virus will not get an opportunity to infect the susceptible group. So NID is very important at this.
Absolutely. So I think National Immunization Day is very critical if we want to eradicate polio. That eradication is so important so that polio doesn't appear once again on the face of this earth. So yes, I think we see the importance of NID, and therefore, what is perhaps the expectation out of Rotary clubs and Rotary members during this NID program?
See, during NID, Rotarians have to be very active. We cannot be complacent, number one. Because our dream is to eradicate polio, not to control polio. We have done controlling part, eradication we have to do. So each of the Rotary clubs is assigned with a primary health center. Rotarians have to go to the assigned PHCs, talk to the doctor, look at what is their requirement, what is the support they need. Because Rotarians are mainly involved in creating awareness among people, social mobilization, so that each child will be counted there. Then third one is we need to give the logistic help. Maybe on that day, a lot of vehicles are required, manpower is required. All that one, they have to take care to see that the last child is immunized. Not even one child is left out. That is what is expected of Rotary clubs. Rotary clubs need to take this seriously and do their job. That's one part. And second thing is, in case we show complacency, in case we do not take up this job, we will go back to the period what we were in 1985. It is said, in case we do not continue with our polio immunization program, in next 10 years, we are going to have 2 lakh children suffering from polio paralysis. And there will be a lot of death also because of polio. So we cannot be complacent at this stage. This is the chance for us. It is something like you have scored 98 runs. Unless you score 100, we can't call it a century. So we are in that small gap. We need to complete the job. That's what I want.
Absolutely. And I see that, that complacence has set in, and that's a very, very powerful message from Dr. Upendra for all of us to know that this NID is so important, and the role of all us Rotarians is really critical if we really want to eliminate polio from this face of this earth, because if not, it is going to come back in a much larger proportion. So the role of Rotarians, and as said by Dr. Upendra, and on through this NID is really critical. But let's look also at what's the benefit we have derived out of polio eradication program so far.
So far, the estimation, what it says is, because of this polio program, 3.64 million children have been protected against this polio-related paralysis, and almost about 3.63 lakh polio-related deaths. We would have lost so many children. We would have had a lot of paralytic cases. And it is estimated that 1.71 trillion USD is saved when you take the productivity into consideration. So that is another thing that has happened. And our health system and our surveillance system has been strengthened. We have the laboratories, we know what to do, how to handle the program, how to work with our partners. We have learned all these things, and it's a very big lesson we have learned. And Rotary is ready to take up any other major challenge. For example, the challenge what we had during COVID. The same mechanism was used there.
Excellent, Dr. Upendra. And I think that's a very, very strong message. And for me, it's very reassuring because honestly, I think we were not aware of the impact we were creating. I think these numbers are really useful. So Rotarians, we have been making a difference. We still need to work hard. We need to get those extra 2 runs, like Dr. Upendra said, and reach that 100% eradication of polio. But let's also, before we have Dr. Upendra getting busy with his other work, let's hear from him one final word for Rotarians and the general public at this stage.
Number 1, let us not be complacent. We have not won the war against polio. Second thing is, let us go to PHCs and ensure that all children aged less than 5 years should be immunized. And general public, I request, please bring your child for immunization. Oral polio vaccine is safe, and let us create hope in the world by eradicating polio, the dream project of Rotary. That's what I want to say.
Wonderful, Dr. Upendra. Thank you for those beautiful enlightenment that you have shared around the importance of NID, the role of Rotarians, and the appeal to the general public. Please bring your children, especially children below 5 years, so that they can be taking the oral polio vaccine. It is painless and it is definitely harmless. And we really look forward to seeking support from all over so that we can eradicate polio from the face of this earth. Thank you very much, Dr. Upendra. And this is your host, Sanjay Duggar, signing out.
Before we complete, let me just add, 3rd of March 2024, we have the NID.
Oh, right. I think it's...
And I want all Rotarians to cancel all their appointments, give the time for NID, see that every child is immunized. That's what I wanted to say at the end.
Absolutely wonderful. I think the date is important. March 3rd, 2024. Please mark this on your calendars. Let's join hands and help on this really, really challenging mission. But yes, we've already reached a good percentage, but there's just that last mile and we need your help over there. On that note, this is your host, Sanjay Duggar, signing out. And thank you, Dr. Upendra, for joining us in this episode. Bye.